We begin this morning with a new survey of Long Islanders and city residents as well, showing some alarming attitudes about the flu shot. Physicians at South Nassau Community Hospital in Oceanside, Nassau County, surveyed 600 people. They found that even though folks know the flu is contagious, a third will still go to work when they have it. More than half of those do get a flu shot, but those who don't get the vaccine skip it because they're worried it will actually give them the flu.
Well, you're getting a little bit of the virus that gives you the flu under there.
Absolutely untrue. There is no way to catch the flu from a flu shot.
They're completely different there? Yeah, they are. One example, at the end of December, in 1 week alone, 850 New Yorkers were admitted to city hospitals to be treated for the flu, so it's definitely out there. Joining us now is Dr. Aaron Glatt. He is the chairman for the Department of Medicine at South Nassau Community Hospital. Welcome to the show.
Pleasure to be here. Thank you for having us.
You bet. And you guys, you did the survey. What surprised you about the results?
So unfortunately, many people still don't get vaccinated. This is a potentially fatal illness, which is potentially preventable by taking vaccination. And people need to use this wonderful tool that we have to prevent disease instead of getting sick and potentially getting a lot of other people sick as well.
Well, you heard right there in one of the interviews we did with a woman there, and I even gave her your response that you just said now about how you can't get it. But she says, look, even if you killed the virus, at some point it was a virus, and it can some way, metabolically or through its matter that still exists within the flu shot, have an impact on people who are susceptible to the flu, especially those with weak immune systems. Any truth to that?
Unfortunately, there's not a shred of truth to that. This is a myth that we've been trying to debunk for years. You cannot get the flu from the flu shots that we're giving nowadays.
If you Google that, you'll find somebody with an article telling you how you can.
So unfortunately, it's just not true, and you can't change science to the way you'd like it to be. Those are the facts. The reason why people think that they get the flu after they've gotten the vaccination is because the vaccine doesn't work instantaneously, and the vaccine's not perfect. And if you're in the middle of the flu season, and a lot of people around you are getting the flu, and you get the flu, you'll attribute it to the vaccine incorrectly. It's like, heaven forbid, a person gets hit by a truck after they got the flu shot. There's no direct causal relationship, but there's a temporal relationship.
So you know, you could make the same argument that you got hit by the truck because you got the flu shot, is what you're saying.
Exactly.
Well, even so, and people have been hearing this debate for some time, and of course people are concerned. They don't want to get sick. They don't want their kids to get sick. They don't want elderly people to get sick, infants. But are you surprised then that 3 in 7 people pass up getting the flu shot? That's almost half.
It's a shame. It really is a shame. We have a good vaccine. No vaccine is perfect. This one certainly is not perfect, but it's a very safe vaccine. It's a good, effective vaccine. And flu is a fatal illness, potentially. Thank God most of the time not, but especially for the patient populations that you mentioned, the elderly, the very young, pregnant women, and even healthy people, flu can be a very serious illness.
It used to be that people worried about the needles, but it seems it's more these myths that you're talking about.
Correct. I mean, people that are afraid of needles, it is a quick shot. It's not very painful. Some people do get some mild side effects from the shot, but it's really minimal. And when you compare it to the potential consequences, it's a no-brainer. I don't know why people don't take more usage of it.
Well, part of it is that we've seen years where they weren't as effective, and sometimes they found that the flu had an outbreak other than what they had predicted. Explain this whole process. It's an imprecise process where they have to predict what kind of flu we're going to see, and there are many kinds of flus.
Yes.
To design a vaccine, it takes months, right, in a laboratory?
So it takes months to do this. So we work off the data from the Southern Hemisphere. We see what strains are circulating there, and they make a best
Because they
guess.
have opposite seasons.
Right.
Like South America, North America.
Exactly.
So you see what's, because it'd be summer when it's winter here?
Exactly.
And so you can look at them when it's winter, and our winter's still ahead, and see what might be coming our way. But maybe the flu goes somewhere else, though,
So
Doctor.
it's not perfect, but it's still pretty good. Last year, for example, we had a very good matchup. The preliminary data from this year looks like it's a good match. The people that are getting flu, those strains are in the vaccine. So the vaccine both prevents flu, but it also can sometimes make you have a milder episode of flu, even if you do get the flu.
So how effective is it this year so far? Do we know?
We don't know. That data really takes a while. But last year, it was probably 65% effective, which means that a lot of people would not have gotten the flu if they'd taken the vaccine who did get the flu. And a lot of people that had serious illness might not have had such serious illness if they'd taken the vaccine.
So what about going to work or school? Why is that such a bad practice if you have the flu?
Well, flu's highly contagious. If a person does get the flu, there's an excellent chance they'll pass it along to their coworkers, especially if they're working together in cubicles very closely, directly within the airspace of each other. And what you will do is you'll make sure that everybody else in your department, friends and not friends, will get sick.
Well, you know, a lot of people are, you know, even like our business, people in our business do not take off, you know, because you're expected to show up for work and do a story and tell people what's going on in the world. It's not the kind of, I remember I worked in one business where you were allowed 12 days off and I was a supervisor, and one of my clerks would take a day off every month, say I'm entitled to them. And when I asked, they said, well, it is entitled. But a lot of people don't have jobs like that with no benefits. One man told me he worked for a bagel shop, and he's afraid his boss wouldn't give him the time off, or maybe he'd look for somebody else if he tried to take the time off.
So it is a concern. That's not a medical question. That's really more of an HR question, a social question. But people certainly should not go into work if they can when they have the flu, because they will pass it on to their colleagues, to their employees. They'll pass it on to customers. It is a highly contagious illness.
So is it too late to get the flu shot? I think most people think you get it, what, October, November?
It's usually recommended to start around October, November, but it's not too late, absolutely not too late to get the flu shot still now. We're in the midst of a big epidemic.
So where do you get it? I mean, most people know, but where can you get it? And is it possible to get it for free?
Yes, a lot of hospitals, such as South Nassau, we do have flu vaccination campaigns where we give the flu vaccine out for free. There are many other community-based organizations that will also provide vaccination either at no cost or just at insurance cost. It's available in pharmacies. Most of the major pharmacy chains, the New York state law allows a pharmacist to give the vaccination, as well as nurses can give the vaccination. And of course, every doctor's office can probably provide you with vaccination.
Kind of didn't mention it, but I mean, it's implied, but people die from this every year.
Unfortunately, yes. It's a fatal disease, potentially. Thank God. We do have tremendous benefit from the vaccine, and it prevents serious epidemics from occurring, but it's not perfect, and people still do get the flu, even if they're vaccinated.
So any tips for avoiding the flu so we don't even need to worry about any of this?
Well, if somebody is sick, they should not go to work and give it to everybody. If you do have the flu and you are around other people, you should try to practice good hygiene, what we call sneezing into your sleeve. Don't sneeze into your hands and then shake the person next to you.
You have to do some dry cleaning afterward, but at least you didn't make anybody sick.
Right.
And then the fist bump,
the fist bump, right.
Which has become popular anyway.
Right. Or
although I get all mixed up, and then it's
in some cultures they give an elbow bump. In
maybe
some
an elbow bump, a knee bump.
A deep bow.
Anything but shaking hands.
Shaking hands with somebody who just sneezed into his hand is a dangerous activity.
Okay, well, it is almost lunchtime, but you're so right. You know, these are just obvious things, but we don't always pay attention, and it's good to be reminded. Not too late to get the flu shot. Absolutely. It does work in the majority of cases, and you can't get the flu from it, right?
Absolutely.
And
not.
You swear on that one.
I don't swear, but absolutely you're not going to get the flu.
All right. Thank you very much. Dr. Aaron Glatt, South Nassau Community Hospitals. Thanks for giving us the medical facts about the flu.
It's my pleasure. Thank you for having us.
You bet. And when we return,